Welcome, everyone. Today's training session on SCI Educational Series number 5, focused on one of the most crucial areas in spinal cord injury, SCI care, skin assessment and pressure injury prevention. Our veterans rely on us not just for clinical treatment, but for our vigilance in preventing complications that diminish quality of life. Today, we will explore how proactive and routine skin assessments, paired with prompt documentation and timely referrals, can drastically reduce pressure injury incidence. We will also reinforce our team's shared responsibility in promoting skin integrity and aligning our actions with VA's standards of excellence. I am Michael J. Orellano, your SCI nurse educator. As SCI nurses and nurse assistants, each member plays a vital role in ensuring safety. Through teamwork, attentiveness, and clinical judgment, we can prevent harm before it begins. Our collaborative goal is to elevate the quality of care while honoring the dignity and trust of our SCI veterans. Let's use this session to refresh our approach and reignite our commitment. In this session, the primary learning objectives are to enhance clinical awareness and improve practical skills that directly affect patient outcomes. First, understanding the risk factors associated with pressure injuries in SCI patients will provide the clinical rationale for why we must remain vigilant. We will also review key components of a thorough and accurate skin assessment, how to recognize early warning signs and document findings properly. In addition, we'll discuss how to escalate skin concerns through timely documentation and appropriate referral to wound care or provider teams. Finally, we'll explore how best practices in skin care and injury prevention can be integrated seamlessly into daily workflows. These objectives not only align with evidence-based standards, but also support the VA's goal of zero preventable harm. Everyone in this room is a vital player in reaching these targets. SCI patients face complex challenges that increase their susceptibility to pressure injuries. A primary issue is the loss of sensation, which prevents patients from feeling discomfort or pain. That typically signals a need to reposition. Without this feedback, pressure can build up unnoticed, particularly over bony prominences, such as the sacrum and heels. In addition, immobility due to motor paralysis further contributes to prolonged pressure in these areas. Circulatory changes and autonomic dysfunction, both common in SCI, impair normal blood flow and skin healing, leaving the tissue vulnerable to breakdown. These physiological limitations require us, as caregivers, to be the eyes and ears for our patients. Routine, targeted skin assessments are not optional, they are mandatory. Recognizing the unique vulnerabilities of SCI patients equips us to act preemptively, reducing complications and preserving life quality. Effective skin assessment requires methodical, consistent, and evidence-based practices. Begin by inspecting all pressure-prone areas, especially bony prominences, for early signs of skin compromise. Indicators such as non-blanchable redness, localized warmth, swelling, or skin tears may suggest the early stages of injury. Observing subtle changes ensures early intervention. Documentation must be factual and objective, avoiding vague descriptions like, "A skin looks fine." Instead, specify size, color, drainage, and stage using the National Pressure Injury Advisory Panel (NPIAP) standards. Use consistent terminology and staging language to promote shared understanding across the interdisciplinary team. Clear documentation supports continuity of care, legal accountability, and timely escalation of care when needed. Every skin assessment documented accurately in CPRs adds a layer of protection for the patient and the nursing team. Documentation serves multiple purposes. It communicates the patient's condition, demonstrates nursing care, and fulfills regulatory and legal standards. SCI staff must record skin assessments during each shift to track changes over time. When documenting, describe the wound's characteristics in detail. Include size in centimeters, drainage type and amount, odor, tissue appearance, and staging. If interventions were implemented, such as repositioning or applying barrier cream, note them explicitly. Documentation should also reflect any patient or caregiver education provided. Promptly notify the provider if concerns arise and include the time and method of communication in your notes. Delays in reporting can lead to serious complications. including infection or hospitalization. Your documentation is a permanent record of patient care that protects both the patient and the healthcare provider team. Pressure injury prevention begins with proactive, scheduled interventions. Adhering to a 2-hour turning schedule helps redistribute pressure and protect vulnerable skin areas. Use appropriate pressure-relieving devices, such as alternating pressure mattresses, foam cushions, and heel protectors to reduce friction and shear. These tools are essential for maintaining skin integrity, especially in non-ambulatory patients. Nutrition plays a vital role as well. A diet rich in protein, zinc, and vitamin C supports tissue repair and resilience. Dehydration should also be avoided as it weakens skin turgor. Lastly, teaching patients and their caregivers how to perform regular skin checks fosters engagement and promotes self-care. This combined strategy ensures that prevention becomes a shared responsibility among patients, families, and clinical staff. Timely referrals are critical when addressing new or worsening wounds. Delayed intervention can mean the difference between a manageable stage 1 sore and a life-threatening stage 4 injury. Upon noticing any sign of breakdown, initiate a referral to the wound care nurse using the SBAR that stands for Situation, Background, Assessment, Recommendation, Communication Framework. This ensures your message is clear, concise, and actionable. Simultaneously, coordinate with the interdisciplinary team, including dietary for nutritional optimization, physical therapy for mobility support, and occupational therapy for adaptive tools and techniques. After referral, continue to track wound progression, reassess daily, and adjust the care plan as needed. Consistent follow-up ensures accountability and reinforces the collaborative nature of SCI care. Why this matters for our unit: reduces preventable harm and hospitalizations, enhances team communication and patient trust, supports VA's high reliability goals, reinforces staff accountability and pride. The significance of pressure injury prevention cannot be overstated. Preventing avoidable complications improves patient outcomes, reduces the risk of extended hospital stays, and supports patient dignity. When every staff member actively participates in prevention, communication improves across shifts, enhancing the team's ability to respond promptly to skin concerns. This directly aligns with the Veterans Health Administration's High Reliability Organization (HRO) goals, a culture where safety and accountability are integrated into every aspect of care. Additionally, taking ownership of these practices fosters a sense of pride among staff, knowing that proactive assessments, timely documentation, and early referrals have preserved a veteran's health and quality of life is immensely rewarding. Let this slide be a reminder that our collective efforts translate into measurable, meaningful impact for our patients and our unit. In closing, every member of the SCI nursing team must embrace the shared responsibility of maintaining skin integrity. Conducting thorough skin assessments on every shift must become a standard practice, not an afterthought. Vigilant observation paired with timely, clear documentation ensures no early warning sign is overlooked. Promptly escalating skin concerns protects the patient from avoidable harm. Collaborating with wound care nurses, providers, and the interdisciplinary team is essential to comprehensive care. As frontline caregivers, nurses, and assistants set the tone for patient safety culture. Approach each patient interaction with compassion, consistency, and a commitment to excellence. Remember, pressure injuries are largely preventable. Through diligence and teamwork, we can achieve a zero-injury goal and become a model for SCI care across the VA system. The following scholarly sources, published between 2020 and 2025, are formatted according to APA 7th edition guidelines and serve as the evidence-based foundation of this academic work. Utilizing current, peer-reviewed literature ensures credibility, supports informed decision-making, and aligns with doctoral-level standards for scholarly rigor, relevance, and professional integrity. Thank you for participating in today's training, and for your unwavering dedication to our spinal cord injury patients. Your attention to detail, critical thinking, and collaborative spirit drives the excellence of care we deliver every day. Please continue to ask questions, seek clarity, and share observations. Each idea you contribute strengthens our team. The challenge of pressure injury prevention may seem ongoing, but together we are fully capable of creating lasting improvements. Let's take today's lessons and turn them into everyday actions. When we lead with heart, skill, and integrity, we change lives for the better. Let us rise to this challenge as one team committed to protecting those who served. Again, thank you very much.